Hi, my name is Antoinette Bruno, and I am going to be responding to the video discussion board post for leadership. And in part one, we're asked how we would address a problem employee as a nurse leader while maintaining a normal, healthy working environment. So I think the key here is to address the situation promptly and privately. I would have the employee come into my office, and this is assuming that they are not hysterical or being rude or cussing, and if they are, I would ask them to take a walk first and try to calm themselves down, and when they're able to talk to me civilly, I would have them back into my office, but I would not let them back on the floor until I spoke with them. So once they're back in my office, which I hope is a neutral environment, I want my employees to be able to come to me before situations get bad, like outbursts or anything. I want them to tell me what's going on so I can help them. I would first ask them what is going on, and maybe just showing a little compassion and empathy would be enough to diffuse the situation and to acknowledge their anxieties. Could be something that they were hoping to have, and that would just settle everything. But I would tell them that their behavior, I would make sure to set boundaries and tell them that their behavior is inappropriate because XYZ. I don't know if it was a patient safety issue or what, but just to be firm and make sure that we address it quickly so it wouldn't undermine the whole staff, because having one staff member who has a poor attitude could really spread easily and decrease the morale on the floor, and you would really have an issue. And it really could spread throughout, like, to how we're treating our patients. It could be a patient safety issue if I let this continue. So definitely would address it quickly. And I would try to understand where they're going at, where they're coming from, show empathy, and set boundaries. That's how I would handle that. And for part 2 of this assignment, we're asked, what is quality improvement and what is healthcare quality? So quality improvement, straight out of the leadership text, is when we use data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. And then for healthcare quality, if we just break that down, what is quality? Quality is how good or bad something is. And I really liked AHRQ's definition of healthcare quality, and they say it's doing the right things for the right patient at the right time in the right way to achieve the best possible patient results. And this is our foundation of nursing. We've been doing this for a while. We've been trying to measure, evaluate, and improve our practice. Starting from Florence Nightingale, she used statistical methods to generate reports correlating patient outcomes to environmental conditions. We did in the 1970s when we made the American Nurses Association, who is a huge role in the nurse-sensitive indicators. They created the database, which 1,100 hospitals contribute to, where we measure a bunch of things that us nurses do and see where we're falling short or what needs to be improved. And these nursing-sensitive indicators, there's several of them. I'm going to run through them really quickly. They are structures of care and care processes, both of which in turn influence care outcomes. And they're distinct and specific to nursing, so it's not anything about doctors or focused on nurses. So some of these indicators are nursing hours per patient, patient falls with injury. These were added, not the original indicators, but added after, because for hospitals requesting this. So that is for the pediatric pain assessment, and pediatric peripheral intravenous infiltration rate, and back to the original, pressure ulcer prevalence, psychiatric physical sexual assault rate, restraint prevalence, RN education, certification, RN satisfaction survey options, skill mix, percent of total nursing hours supplied by RNs, LPNs, and unlicensed assistive personnel, voluntary nurse turnover, nurse vacancy rate, nosocomial infections, which include urinary catheter-associated UTIs, central line catheter-associated bloodstream infection, and ventilator-associated pneumonia. So what are 2 ways where I can impact these? I think I'm going to talk about the, first of all, the nosocomial infections. We can do a lot as nurses to prevent these infections, and one of them being like for ventilator-associated pneumonia. We know that oral care is very important to do every 2 hours. We're going to swab out the mouth every 4 hours. We're going to be making sure we're moving the vent tube from one side to the middle to the other side of their mouth. So, and then once every 8 hours, we're brushing their teeth, actually brushing, getting their tongue and everything. So we'd be doing that. And then for urinary catheter-associated UTIs, I'm going to be making sure every shift we're giving urinary cath care to prevent that UTI. And then another nurse indicator that I could directly influence would be restraint prevalence. We don't want to restrain a patient, right, for just anything. We're going to try different methods here before we restrain. Like, I know sometimes it can't be helped. We need to help make sure the patient and staff stay safe, so sometimes it is needed, but just to be able to try things first before I restrain my patient is what I do. I would make sure, is it something that are they bored? Are they not understanding? Are they confused? Am I assessing them appropriately? Could I just get a sitter? So multiple things I could run through. I could put on a movie for them, just trying to distract them. I could move the patient closer to the nurse's station so I have better eyes on them and maybe they just need more attention. So I could, those are 2 things I would do.